Between COVID-19, seasonal allergies, monkeypox, and all other ailments, illnesses, and concerns, there's a lot to think about on the medical side of life in Michigan today. Here now to help clear some of the confusion around these many different issues is Dr. Jamie Taweel from Grand River Medical Associates. Dr. Taweel, thanks for being with us again.
Thank you for having me, as always. How are things?
Appreciate having you on. So last 2 weeks in the state of Michigan, as we mentioned earlier on in the program, from an article from Bridge, Michigan, and their coronavirus tracker. Case numbers in Michigan continue to be trending upward. Last week, just around 1,960 cases per day. In the past week, it's just a few shy of 2,000 cases per day, and those are being attributed to mostly the BA.5 variant of the Omicron subvariant of the Omicron variant of COVID-19, but also the BA.4 variant. Can you tell us a little bit about what you know about these two subvariants of the Omicron variant, why they're so much more transmissible, and the ways they're kind of interacting with our community at this time?
So the BA.4 and the BA.5 variants are the newest subvariants of the Omicron virus. And by the way, thank you for asking. Great question. Those new variants have identical spike proteins. They're pretty much responsible for up to 80% of COVID infections in Michigan, according to the CDC website. 80% for the BA.5, roughly 15% for the BA.4. Now, these two viruses have identical spike proteins, which are the proteins that attach to cells and allow them to get in. And the reason this variant is becoming so much more prevalent is because it is irrespective of whether or not you've previously had COVID. So people that have previously had COVID, which, not all people, but a lot of them feel that they have a little bit of immunity since they've been exposed, that, all right, I've had it, I'm done, I don't need to get it anymore. Whereas with this particular variant, it is now, if you've had it, it is irrespective of whether or not you've had antibodies to COVID, you will still get an infection with this particular variant. So you're seeing people that are getting it 2-3 times that are starting to just kind of cycle through variants. And that's why it's becoming a lot more noticeable. And plus, the other thing to this is that excuse me, your window for transmission and your length of being infectious to other people is a little bit longer by a few days. So that means people are still contagious for a little bit longer of a period of time, which also leads to further infections.
We're joined by Dr. Jamie Taweel from Grand River Medical Associates joining us on the Michigan Megacast. More information and to get in contact with Grand River Medical can be found at grandrivermedical.com, grandrivermedical.com for more information. And Dr. Taweel, going off of that information, knowing that these particular subvariants in many cases are able to infect people that have been vaccinated and are unvaccinated, and those that have some natural immunity as well. Many are going to then, or are currently then, asking the question, well, then why do I need to get vaccinated? Or why should I get a booster for COVID-19 if regardless, I'm going to get COVID-19 from these two subvariants?
Well, the reason for that is because, while the BA.5 variant is responsible for up to 80% of the infections that are out there currently, there are still other variants that are still out there. And this will also continue to mutate as always. So any type of vaccination that you have to create antibodies to this particular virus will be helpful to some degree. You don't want to backslide or get older variants that are definitely more dangerous than the current one. The BA.5, although it spreads more aggressively and it is a much easier to get, and it is also resistant to certain types of antibodies, but you have to realize that it's a little bit less virulent, which basically means you're not going to be as sick as other people, but the sheer volume of people that will get infected could still become an issue and a burden on the health system. So being able to vaccinate yourself against previous variants, any potential new variants, as well as some degree of, maybe even if not mild, reduction in severity of symptoms, any option that you're going to be able to take to get yourself in a better position than anybody else, I would recommend getting that option. I would recommend taking that option.
Yeah, the point since the beginning, and that's been discussed to the communities in regards to these vaccines, is that they're not going to prevent you necessarily from getting COVID-19. They're aimed at preventing more severe cases and reducing the load that infections our communities have on our public health systems, especially in those areas of the state that don't have large hospital systems in the area or even have great medical coverage in terms of primary care physicians in the local area too. Those are really important communities for people to be considering getting vaccinated or taking those precautions, because while the spread of COVID-19 has it can have up to severe impacts on major cities and major metropolitan areas and large counties like, Oakland County, Wayne County, Ottawa County, and so on, others in the UP. Many other community areas, many other counties are any sort of additional load on their hospital systems, on their medical systems, could be significant and fatal in many cases for people in smaller areas of Michigan.
Yeah, absolutely. You want to be able to reduce that risk, and anything that you can do to reduce that burden. I mean, patients have been telling me nonstop, it's a nightmare going to the ER because there's so many patients that are in there for COVID, and that while that number is declining, the amount of people that are getting infected is going up. So even if it's milder cases, people that are going to the ER for, it's not just even testing or diagnosing or potential, people that do get COVID want to go in there and get their infusions of monoclonal antibodies. Although a lot of the monoclonal antibodies that are out there are not necessarily as good to fight against the BA.5 variant. Some of them still are, as well as BA.4 and BA.5 are also showing that they are responding to the newer drug that's out there called Paxlovid, which is the oral medication that you take. But going back to the comments that you're making is we really want to just reduce the amount of burden on the healthcare system. When you have a pandemic where you have things that are going on, the availability of help is basically the most important thing. So if you are flooding that availability with other variants, other issues, it becomes a bit of a problem because people aren't getting the help that they need. And it's frustrating because we're, as a society in most areas, are just used to being able to get help the minute we need it. You can get in to see somebody. It's urgent cares everywhere. But when it's overwhelmed, it becomes a problem. And these people are now being forced to wait. And as any illness will show you, as history has shown you, time is important. Getting there early, getting treatment quickly, getting treatment aggressively as fast as possible, reduce further bad outcomes down the line.
We're joined by Dr. Jamie Taweel. He is an internal medicine specialist at Grand River Medical Associates, joining us on the Michigan Megacast. You can keep up to date with Grand River Medical Associates and get in contact with them by visiting grandrivermedical.com. Grandrivermedical.com is their page. So all of that being considered, Dr. Taweel, so many people out here in our communities in Michigan and around the U.S. and in the world right now with the COVID-19 situation being different than what it was maybe a year ago, and certainly from what it was 2 years ago. Right now, with everybody getting back out into society in so many cases, or a lot of people getting back out into society, not necessarily everybody, people bring up the question, is the pandemic over? Or they behave like the pandemic is over. Is that, where are we in terms of this? Because it is kind of a confusing gray area for so many people where it's not necessarily as intense maybe as it was 2 years ago, but it's still very much a factor in our communities.
Absolutely. Previous to this, I mean, if you could just remember, we love to forget, but I mean, 2 years ago, we were in lockdown. We were wearing masks. We weren't able to do anything. We were wiping down our groceries. Nobody knew what was going on. It was a bit of a concern. People were we were learning as we were going along. And I've used this example in previous interviews with you. I've said it a million times. You're going to hear it again. At the time, we were working on a car, like doing mechanics work metaphorically on a car while we were driving it down the highway at 80 miles per hour. Weren't able to really kind of piece things together. We now have so much more knowledge and so many more treatment options that it has now become not as aggressive. We now, if you get sick, you do have Paxlovid, you have remdesivir, you have monoclonal antibodies, you have all these other options. And these options have been proven. And although they're still approved for emergency use in some situations, a lot of these things have been helpful. So with that safety net that we are now getting a better grip on our knowledge of what's going on, the one factor I want to make sure that we're aware of is long COVID, the symptoms that go on for long periods of time, things like that. We discussed that last time. That still remains to be seen. But for the most part, in terms of infectious and things like that, people have a little bit more of a sense of security. Is the pandemic over? Certainly not. But at the same time, it's not as much of a threat as it was previous because A, we have treatments, B, we have knowledge, C, we have an idea of what works and what doesn't. We have precautions that we can still take. And most importantly, we have a variant that is less severe as the previous variants, thank the Lord, but that doesn't mean we can't get a variant that's more dangerous. So keeping our antenna up, so to speak, to make sure that we're not going to continue to get recurrent variants is important. And I do recommend that people still maintain that level of awareness.
We're joined by Dr. Jamie Taweel from Grand River Medical Associates on the Michigan Megacast. Dr. Taweel, another situation that's giving people some parallels to the COVID-19 situation is seeing the spread of monkeypox being reported across the world, including here in the U.S. and in the state of Michigan. And in this case, this is a disease that spreads very much differently than COVID-19. But that being said, with it being spreading around the world and it being spread also here in the state of Michigan in some isolated cases as well, many will make those parallels between these two situations, especially with the pandemic continuing on. Tell us about the monkeypox situation, how it's different from the COVID-19 situation, and how people should be taking precautions.
So monkeypox is a totally different situation, and the reason for that is because it is spread differently. The spread is typically through contact with fluids or fomites, which is basically clothes or surfaces that have fluids on it, and it has to get kind of connected with into your body via a system of either abrasions, cuts, oral mucosa, things like that. There have been cases where monkeypox can be spread through respiratory droplets back and forth between people, but they have to be in close proximity for an extended period of time. So if you're using the precautions that you're using for COVID, your risk of monkeypox goes down considerably. In addition, it's more or less spread also through sexual contact. So making sure that you're maintaining those types of precautions will definitely reduce that risk. It can spread, it does spread. The other issue with regards to monkeypox is getting treated and diagnosed for it. This is relatively, although it's been around for a long time, this is something that we as primary physicians haven't seen in my entire practice of medicine. I haven't seen cases of it. There's been mild outbreaks, but none of them have been, near this area. We now have 16 reported cases in Michigan as of recently, as of today, I believe, where the diagnosis of it, the symptoms of it can mimic other things. They're basically these small, particular rash that shows these small pustules that can be confused for other problems. So usually a patient will come to a physician that has not been exposed to exactly what monkeypox is. He may look at it and say, oh, that's a simple infection or a sexually transmitted disease. If you're having a history of sexually transmission, a history of unprotected sex, you now have a physician that's looking at it going, oh, I don't necessarily, it's not going to be to the forefront of his mind. He will try treating with other options if he's not aware of it, if it's not on his radar. Now, once that becomes an issue where physicians now have an idea, hey, this might be monkeypox, we are now further down the line. And as I've said previous, the earlier you can get treated, the earlier you can get diagnosed, the better off you are. The other problem that we're dealing with in this particular situation is testing. Testing is very difficult to get. You have to get approval. You have to submit pictures of the rash to prove that you have a very strong inclination that this is, in fact, monkeypox. Once that happens, you get approved. You send them to one of the few labs in Michigan that can do this. And most of those labs are a send out. So it can be even up to a week before you actually get a diagnosis. By then, we're now worried that the spread may have continued or the person has declined significantly health-wise or even possibly improved health-wise. So, it's the delay in care that's going to be the biggest issue here.
Joined by Dr. Jamie Taweel from Grand River Medical Associates on the Michigan Megacast. You can find more information on how to get in contact with Dr. Taweel as well as the services at Grand River Medical Associates by visiting grandrivermedical.com. grandrivermedical.com for more information. Dr. Taweel, in the past we've talked about people being hesitant to go back to their primary care physician during the throes of the pandemic, and even as the pandemic started to change and situations outside of the home and the workplace have maybe not been as cautious as they've been in the past. Are we still seeing that as being a bit of an issue among your clients, among those that you converse with in the medical community? Are people going back to their primary care physicians for those routine checkups?
Oh, people are, absolutely. Good. Thank the Lord. People are starting to get back in track. They're starting to, we're dealing with the backlog of all the people that weren't going previous to this now. So things are, my practice is still swelled in business in terms of people that are now, all right, it's been a while. I'm out of medications. I need to be seen. Physicians are still offering telehealth services. That's still available to a lot of people. And I do it on certain occasions, certain emergencies. It is definitely something that can be done. People are now becoming more, and also I will say that people are also hesitant to go to urgent cares to some degree because a lot of people are just running to urgent cares anytime they have such suspicion for COVID. So with that being the case, people are now starting to come back to their primary cares to get all of those routine health screenings, and we are starting to pick back up. Thankfully, people are doing much better, and I am very pleased for that.
Dr. Taweel, just another couple minutes with you before we say goodbye today. Anything else that people should be keeping in mind right now on the medical side of things here in the state of Michigan that they should maybe be conversing with their primary care physician about or keep an eye out for in the future?
Absolutely. The big concern is COVID's always at the forefront of people's minds. So everybody always has a sniffle and wants to know if they've had COVID, or we at least want to know if they've been tested for COVID. But once that's out of the way, common things are still common. Allergies, still common. Issues with regards to cholesterol, sugars, all of those risk factors that make you a bigger target for something like COVID, those are still there. So I do want people to come to their primary care physician and please to still get their routine checkups. Still make sure that they're being very aggressive about controlling their allergies, as this has been a rough season for allergies. Mine included. You probably hear me clear my throat nonstop throughout this interview. It can be out there, so please bear that in mind. The other thing is the emotional impact of this entire pandemic. I'm seeing a lot more patients that are having issues with stress, anxiety, depression, the frustration of working from home, the frustration of having to go back. These adjustments can be really, really taxing on you on an emotional level. People don't always want to talk about their emotional health with their physicians because they feel like it's a sign of weakness. It most certainly isn't. I would encourage them to do that because it's very important to make sure that you're being taken care of on all levels, and your mind is your strongest organ. So I would want patients to please bear in mind that now that the weather is nice, you can go out there and practice a lot of self-care. Please work out. Please enjoy the sunshine. Please take care of yourselves and make sure that emotionally you're doing well. Your stress levels are managed. You're being treated, you're doing what you can, and please have those conversations with your doctor. I often feel that gets overlooked.
GrandRiverMedical.com for more information and resources. Dr. Taweel, appreciate your time.
Thank you, as always. I really appreciate you having me on and allowing me to speak.